Bismillahirrahmanirrahim. Assalamu alaikum. The immune system protects the human body against disease by dispatching a bunch of immune cells whenever the body encounters foreign material or antigen. These immune cells elicit an inflammatory response in order to remove or eliminate the foreign antigen without causing much damage to the host. However, under certain conditions, the host may elicit an exaggerated or inappropriate immune response, and this is termed as the hypersensitivity reaction. And this is going to be our topic of discussion for today's lecture. So let's start. The learning objectives for today's lecture are to define the hypersensitivity, to know the different types of hypersensitivity reaction, to understand the mechanism of action of each type of the hypersensitivity along with the example. So hypersensitivity is an undesirable reaction which is produced by normal immune system. It includes the allergy and autoimmunity. The term hypersensitivity is used when an immune response results in an exaggerated or inappropriate reaction that is harmful to the host. A hypersensitivity reaction occurs when the body responds to otherwise harmless substances which is otherwise ignored. In this case, the body recognizes the substance and it triggers the inflammatory response. Usually, these harmless substances are called as the allergen, and the inflammatory response is referred to as the allergic reaction. An immediate allergic reaction is the type 1 hypersensitivity reaction, and this requires pre-sensitization. During sensitization, the body's immune system initially comes into contact with the allergen. So in tissues, the allergen will bind to the receptor present on the surface of the B cell. A part of this antigen is then transferred to the MHC class 2 molecule and presented to B cell surface. So when the receptor of the T cell it binds to this complex, the T cell is then activated, and as a result, it will release the cytokines. Now, these cytokines will activate the B cell. So, as a result of these cytokines, they will start activating the B cell, which in turn will releasing the IgE antibodies. Now these IgE antibody are docked onto surface receptor present on the mast cell, which are now able to respond when re-exposed to the same antigen. The individual is now sensitized to the antigen or allergen. Upon re-exposure, the allergen binds to the IgE receptors, cross-linking the adjacent receptors, and this leads to the mast cell activation, inducing the release of inflammatory mediators. And this process is known as the degranulation. These released mediators then can cause bronchoconstriction, leading to respiratory distress, vessel dilatation, reduced blood pressure, leading to the edema formation, local inflammation with heat, redness, and itching. One of the special features of type 1 hypersensitivity reaction is that once it is sensitized, the response to the allergen is immediate and can occur within seconds to minutes of the exposure. Other types of the hypersensitivity reactions are relatively slower and they can develop after hours to days. Now, the type 4 hypersensitivity reaction. Type 4 hypersensitivity reaction is a T cell mediated response primarily caused by the CD4 T cells. Type 4 hypersensitivity reaction is also called as the delayed type of hypersensitivity because of its delayed onset of the reaction. The type 4 hypersensitivity reaction starts with a sensitization phase, where an individual is first sensitized to an external agent or an antigen. During this phase, the exogenous antigen is picked up by an antigen-presenting cell, which is also called the dendritic cell. The dendritic cell then swims to a nearby lymph node and presents this antigen to the CD4 T cell via MHC class II molecule. On presentation of antigen, the CD4 T cell, they will recognize this antigen via their surface cell receptor. Thus, they could differentiate into different T helper subtypes depending on the certain cytokines produced in the environment. So in type 4 hypersensitivity reaction, the differentiation is usually skewed towards the T helper 1 subset of CD4 cell. The antigen presenting cell, they produce certain cytokines such as IL-12, IL-8, which will help in this process. Sometimes the antigen presenting cells, they could also produce certain cytokines like IL-6, IL-1, and transforming growth factor beta, which will then cause the CD4 T cell to differentiate into T helper 17 subset. So the subsequent exposure of the antigen, they will form the effector phase of reaction, and the manifestations usually peak at around 48 to 72 hours of the second exposure. That is why it is called the delayed type of hypersensitivity reaction. The antigens are then once again picked up by the antigen presenting cells, and this time they are presented to the T helper 1 cell, which kicks off a cascade of the reaction. On recognition of the antigen, the T helper 1 cell, they produces cytokines such as the interferon gamma. This interferon gamma will then activate the macrophages, making them super active and alert. Now, these activated macrophages have the better antigen presenting abilities, increased MHC class II expressions, and improve phagocytosing capabilities. So these activated macrophages, they will start releasing mediators which will cause the inflammation, and they will also cause the leukocytes to leak out of the nearby blood vessels. Now the leaking monocytes, they will differentiate into macrophages, which are again activated by interferon gamma. Now the accumulating macrophages in the site of infection, they will release lytic enzymes and free radicals to help remove the offending agents. And at the same time, this process will also damage the tissue in that area. However, sometimes the offending agents are not removed and they persist despite the inflammatory process. This is usually the case with the chronic granulomatous infections, for example, TB, sarcoidosis, and some fungal infection. The consistent activation of the macrophages by interferon gamma, they causes the macrophages to transform into epithelioid cells. This may also cause the fusion of the adjacent epithelioid cells to form the multinucleated giant cells, which are the Langhans type of giant cells in case of tuberculosis. Now these epithelioid and the giant cells, they are surrounded by lymphocytes and fibrosis. This whole mass is known as the granuloma. Type 4 hypersensitivity reaction could also be mediated by CD8 T cytotoxic T lymphocytes. Autoimmune disease like type 1 diabetes, rheumatoid arthritis, graft rejections, and viral infection have the CD8 T lymphocyte mediated tissue damage. The CD8 T cells, they recognize the class 1 MHC molecule along with the antigen, and then they destroy the infected cell directly via the process of apoptosis. Now the type 3 hypersensitivity reaction, which is also known as the immune complex hypersensitivity. This type of hypersensitivity reaction occurs when the antigen and the antibody complexes, they induce an inflammatory response in the tissues. First of all, all the immune complex they deposit in the tissue. Then this activates the complement system. Then the neutrophil, they are chemotaxis to the site of the immune complexes. And then the proteins that are the complement system protein, they will get attached to these neutrophils. And finally, after attachment of these proteins, they will then go attached here to the tissues, and side by side they will also attach these immune complexes. So finally there will be adherence as well as the degranulation of these neutrophils, which will lead to inflammation and the tissue injury. Now, example of the type 3 hypersensitivity is the Arthur's reaction. This is a local immune complex deposition phenomena. For example, this is seen in the diabetic patients who are receiving insulin subcutaneously. The local reactions occur in the form of edema, erythema, and necrosis. Immune complex, they get deposit in the small blood vessel, which will lead to vasculitis, microthrombi formation, vascular occlusion, and necrosis. Now, this is again another example of immune complex mediated hypersensitivity reaction. This is the morphology shows that there is the immune complex mediated injury. It is actually the acute necrotizing vasculitis. The necrotic tissues and the deposits of the immune complex, complement, and plasma proteins, they produce a smudgy eosinophilic deposit that obscure the cellular details. And this appearance is termed as the fibrinoid necrosis. Now coming towards the type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction mainly involves the antibody-mediated destruction of the cells. The antibody are produced by the immune response. They bind to the antigen on the patient's own cell surfaces. So the antigen recognized in this way may either be intrinsic, that is the self-antigen, or extrinsic, adsorbed onto the cells during exposure to some foreign antigen. These cells are recognized by the macrophages or dendritic cells, which then act as the antigen-presenting cells. You can see this process here in this diagram. So, example of this cytotoxic hypersensitivity reaction is this includes the transfusion of mismatched blood type and autoimmune hemolytic anemia. This is the example of cytotoxic hypersensitivity reaction. This table basically gives the overview of all the 4 types of hypersensitivity reaction, along with their time duration, their characteristics, and their related examples. This is another table which is the immunological aspects of hypersensitivity reaction. And then this is the table of clinical aspects of the type 1 hypersensitivity reaction. This will give you an overview of the clinical aspects of type 1 hypersensitivity. All these tables are given in your book. And this is again the clinical aspects of the delayed type of hypersensitivity. This is again given in your book. These tables are very important from your examination point of view. That's all for immune system. I hope you got an idea of how the system works. The immune system is one of the most important topic of this pathology subject. If you still have any queries, you're welcome to ask on WhatsApp or Facebook page of the pathology group. Hope to see you all soon, inshallah. Take care. Allah Hafiz.